This episode is brought to you by Indeed. When your computer breaks, you don't wait for it to magically start working again. You fix the problem. So why wait to hire the people your company desperately needs? Use Indeed's sponsored jobs to hire top talent fast. And even better, you only pay for results. There's no need to wait. Speed up your hiring with a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
This episode is brought to you by Prime Video. In the small town of Holland, Michigan, nothing is ever what it seems. Behind the tulip festivals and pretty houses lay dark secrets that threaten to tear a marriage apart. Nicole Kidman stars in this darkly twisted thriller about a wife and mother whose quest to uncover her husband's secrets may get her more than she bargained for. Holland, streaming on Prime Video March 27th.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. Hello, everyone. Happy Monday. Welcome back to another episode of the Dental Download podcast. I'm your host, Haley. I am officially 10 months of working, just past that a few days ago. And I ran all my production reports and procedure reports and things from EagleSoft for all of 2024, which was 6 months of working, and then up until the start of March. So basically the first 2 months of 2025. So I don't have any data on March. So technically it's like 9.5 months of data, but you get the point. So before we get right into 10 months of working, kind of the clinical side of things, I want to do our solo episode, little segment of life updates, recommendation of the week, motivator this week, and one thing I learned this week. So life updates. Weddings are getting closer. My sister's wedding is coming up in like 6 weeks. So we've had a lot of stuff going on for her specifically. And then also our wedding is in October. So recently we've been investing in a lot of those wedding things like our honeymoon flights. We bought our wedding bands. So that's been very fun and also a little stressful, as you can imagine, but mostly fun and exciting. But I'm looking forward to the next couple months. We don't have to travel again for any weddings or just events around the country until end of May. So anything else in April and early May is like local, either events, weddings, things like that. So it's going to be nice to kind of be home a little bit more and save a little bit more money, which I'm looking forward to. And then also we recently put our official earnest deposit down with our builders for our house build, and we're several weeks into the process of getting our official loan documents prepared with the bank. So hopefully this next week we'll get our final documents back and can actually sign and let them disperse the funds to the builders to get started. I don't know, ideally at least by early April they can get started. I don't know how quickly from when the bank says yes that they actually have contractors ready to come and start working, but hopefully relatively quickly. I know they already got all the bids and all of that squared away, of course, to even be able to give everything to the bank. But it's an interesting process, and I'll probably be documenting the house build stuff over on my YouTube channel. It's just my name, Haley Schultz. If you're kind of interested in what that's going to all be like, it should be a pretty fun and interesting process, given that we've never built the house before. So we are going into it a little bit blind, other than advice from other people and a lot of Facebook groups that I'm in. So my recommendation of the week is actually a book that I've been reading called The Psychology of Money. And it's quite good. It's something I've had highly recommended to me by different, like, again, social media people that do finance content. And what's nice is that it's really short. A lot of the books I've been trying to read lately, I either just don't finish because I'm not interested and they're so long, or I just haven't gotten around to finishing. I've been pretty bad at reading this year, I would say. But I want to finish 4 books by the end of March, like for the whole year. So I've read 2 so far. I'm almost done with The Psychology of Money, and then I'm partway through book number 4 as well. But what's nice about Psychology of Money is that it is pretty short, probably only going to take you 3 or 4 hours total to read. So I highly recommend it, and it's been very insightful, and just I think there's a lot of different takeaways you could get from it, and it lets you kind of figure out your own views on money and if those are maybe positive or negative and what to do about it. My motivator going into this week is that I'm excited to be traveling 1 week from today to the week-long implant pathway fast track course that I'm taking in Arizona. I'll have more on that later in this episode. And then one thing I learned this week. So I was having a dilemma because of my own, as most dilemmas are, self-imposed feelings and emotions regarding feeling a little scared and intimidated and awkward reaching out to patients via phone in terms of following up on their treatment that was not scheduled. So if I planned something in a hygiene exam and they said, oh, okay, well, that's kind of a big thing. Even if they sat with one of our treatment coordinators, they even left that appointment saying, I just want to go home and talk to my wife, or I'll call you back later this week. So those kind of deferring things that we also know as a team that we should have been better about scheduling a specific next step, not just waiting for them to call or trying to reach out, but having an appointment on the calendar, a date and time that they're expecting to talk to us as a follow-up. So obviously that could have been better. But I had asked one of the people involved in the coaching program that we work with at my practice just for advice on how to go into that to feel less awkward, feel less pushy, feel less bothersome, because I'm just calling them out of the blue. And again, they're not expecting our call because we didn't schedule anything. So I just felt like I was being kind of pushy and annoying. She had a lot of great insight, but the one thing I'll share is what directly addresses my concern of feeling pushy or like I'm bothering them by calling out of the blue. And that was shifting my own mindset about the call to be that it's not pushy or annoying or bothersome. It's simply a continuation of their appointment. So things did not get scheduled. This follow-up is just continuing their care plan. These specific people did not say, no, I don't want to do it. Don't ask me about this again. They understood clinically why it should be done, but it was probably more so, if we're being honest, the financials about things, right? So they said, let me go home and talk to my spouse or something like that, which basically translate to not yet. It's not a no, but it's a not yet. So therefore, I do have the permission to call them and follow up and continue to offer support on their process for getting healthy and viewing it as a no pressure to schedule follow-up call to see how I can help. And it's a continuation of their appointment, following up on their care plan. Those kind of notions helped me a lot when it comes to calming my own nerves or self-imposed awkward feelings going into those calls. So if that's something that you've thought about or struggled with, maybe take that mindset yourself and see if that can help. But now we can get into the bulk of the episode, which is 10 months as a dentist. So what's interesting kind of going forward too, you can keep this in mind, but I think I've been saying 2 months of a dentist, 1 month of a dentist, 3 months as a dentist, and then I did 6 months, and then now I'm doing 10 months because that was 9 months a little bit late posted, is most people being dentists are, I think, looking at the first 6 months, they matter a lot, but then once you pass the first 6 months, then you're really looking at your first calendar year, not so much my June to June year of 1 year of working, more so now looking at the goals for 2025, my first full year, calendar year, start to finish as a dentist. So it's not that the first 6 months didn't matter, but a lot of people, including myself, those first 6 months were kind of just like a warm up, freebie time, kind of a wash, just like feeling out your potential pace, potential income, earning potential, and kind of establish with that data what you want your goals to be for your first calendar year. And that just makes more sense with the way taxes in the world works, right? So I am going to do a 1 year as a dentist episode in June, so after 1 full year of working. But other than that, the timeline is really going to be then scaled to calendar years. So my goals for 2025, the clinical goals that I've shared with you all for 2025 will be what we'll focus on going forward more so. Procedures is the first kind of topic that we'll talk about. And based on my procedure report here, I did about 1,700 procedure codes in all of 2024. So, I mean, that's each extraction I did, each filling I did, each SDF I applied, each PA from a limited exam that was billed out under me, All of the hygiene stuff doesn't get billed out under my name, only the actual exam portion, not the x-ray. So I think that would make a big impact if every hygiene appointment that I went into, all the x-rays were under my name. So that's not in here. But keep in mind, it's a lot of numbers that don't really mean much. It's not like I've done 2,000 crowns, but I have done over 100 crowns just in the first year. And kind of putting that into context with the amount of crowns that I've done in the first 2 months, January and February, is, 48. So almost half of what I did for the first 6 months and only the first 2 months of this year. So that's, I think, moving in a good direction. And that probably correlates well to my skill set starting out of school, and how I mentioned in the first couple episodes that I was still getting a handle on the workflow of crowns being as efficient as possible and having them designed in CAD/CAM really well so that they always seat perfectly. That wasn't the case the first couple months, but after I took that CE course, it built my confidence and taught me a lot. And going forward, I feel like I don't have any trouble with my crowns. So therefore, I'm able to do them more quickly. Maybe you're more apt to plan them when you're more confident in something. So that could be a component, right? But pretty much the number, it doesn't matter that much. But I just think it's interesting to see kind of the scale, because then in the first 2 months of 2025, I had 650 procedure codes. So 1,700 in 6 months and then 650 in 2 months. So, that's pretty much trending to be about even procedure codes wise for 2025 with a little bit more. So not anything blowing it out of the water, 2x, 3x what I did in the first 6 months, because I have always felt that pretty much coming out of school, I've had decent pace and I've had decently nice full schedule thanks to my team. So it's not like I'm expecting to just 10x what I did in the first 6 months, because my schedule and everything was already running fairly well. So that is going to eventually, we'll talk about kind of my production goals and how I think I am where I am and what I think could change to get me to that next level. But before we do that, again, just kind of reflecting on procedures, I've mentioned crowns. And then another thing that I've mentioned in the past that was challenging for me that I was working on improving was surgical extractions. So the first 6 months, I had about 26 surgical extractions and over 60 normal extractions. And then in the first 2 months of this year, I've had almost 40 normal extractions and 10 surgical. So I'm not doing nearly as many extractions as I am fillings and crowns. In all of last year, I can't even add all these up quick enough in my head.
This episode is brought to you by Walmart. New beauty is in bloom at Walmart, and it's all about springtime radiance. From Drybar, Tula Skincare, and hundreds more available online, Walmart has the premium brands you want and this season's on-trend products for flawless, glossy hair and hydrated skin. Big name beauty brands? Check. The things you love? Check. Find trending spring beauty and all you need to look and feel gorgeous at Walmart, on app and online.
Are your ulcerative colitis symptoms proving difficult to manage? Tremfya guselkumab can help you manage the cycle of UC symptoms. At 1 year, many patients taking Tremfya achieved clinical remission, and some patients also achieved endoscopic remission. Individual results may vary. Tremfya is a prescription medicine used to treat adults with moderately to severely active ulcerative colitis. Serious allergic reactions and increased risk of infections may occur. Before treatment, your doctor should check you for infections and TB. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Ask your doctor if Tremfya can help you manage the cycle of UC symptoms. Call 1-800-526-7736 to learn more, or visit tremfyaradio.com.
Probably 200 class 2s, probably another 250 in other surfaces, so class 1s and anterior 1 and 2 surfaces, exterior 3 surfaces, all those different things. So probably almost 500 fillings. And that's like per tooth done in the first 6 months. And then compared to now, I've done about 200. Oh no, more than that. I'm not even looking at the right line items. Sorry guys, it's hard to read these papers on the spot, but more like 275 probably in the first 2 months alone. So again, the amount, I guess, of restorative that I'm doing is quite scaled up from the first 6 months, but obviously we're looking at just all of the numbers from the first 6 months, not month by month, which probably would be a little more telling, like if we had a, bar graph or something, because I don't think in June I probably only did like 10 or 20 fillings, but maybe in October I did 60. So it's just like not as accurate to like the scale that it's growing at. But I do think that's kind of relevant to just keep in mind. I'm doing a lot more restorative than I am surgery. But all that said and done, I still feel a lot more confident with surgical extractions than I used to, for sure, because that number of whatever that is, almost 75 of them over the whole time I've been working, is so much more than what I had in school. So that greatly helps with my confidence levels. And while we're talking about challenging procedures, like I said, in other episodes, I know I've mentioned crowns before, I know I've mentioned surgical extractions before, but what's my currently kind of hardest procedure thing I'm working through? It's definitely the kids, pediatrics. And it's not that in the chair I'm having a hard time. Most of the time, it's pretty good with getting them numb. Obviously, some kids still just freak out and you have to send them home and refer them, not just send them home, but refer them. But I feel like I'm struggling a little bit with our patient base that's the state dental insurance, because not many offices take it, especially not the specialists. So these families are coming in and that's the only way that they can get this care is with that insurance. They don't have money for the treatment otherwise in some of these scenarios. So it's not so much that I'm having a hard time like doing a filling on a child or getting them numb, but it's more so planning them for the most ideal definitive treatment, which is what I try to do with all my adult patients, knowing my own skill levels when it comes to pediatrics. So maybe it would make more sense to go right into pulpal therapy, but I might not plan all the way to that because of my own comfort levels. So maybe I'm not comfortable doing a full root canal on a maxillary molar. And in these scenarios, I obviously do discuss all that with the parent that, it would be most ideal with this many severely decayed teeth to see a pediatric dentist or an endodontist, whatever the case may be for this child. But when the parents say, well, we can't afford it, like can we try to do it here? Then you're going to say, okay, like I'll do my best. And you might get a little more creative or treat the decay and monitor from there. But sometimes I feel like I'm kind of reaching quite a bit beyond my comfort level when it comes to these treatment plans. And it can be just hard emotionally when you have kids because, not necessarily like they're choosing to be in this situation and have pain or decayed teeth necessarily. It's much more multifaceted than talking to an adult patient about their problems. And I think maybe not everyone, but I have a lot more emotions tied to feeling bad or guilty or all these other negative things when it comes to treating the kids, just like wishing it could be perfect. And I know with the more I do, the better it's going to be. And, self-critique and just always trying to do my best. And obviously if something's not clinically acceptable, like I'll take it out and redo it or whatever it may be. But it's just very tough mentally and emotionally, I guess, is what it comes down to. These kids in this specific scenario where it's hard to refer them because either they can't be referred anywhere that will take their insurance with their specific scenario of what I'm trying to refer for, or even if I can, to the one place that takes it and they meet the criteria to be referred, whether it's age or number of carious teeth, like all of those things are cutoffs that this accepting doctor takes because they have to, because there just would be too many kids. So I get it. But even if I do have the ability to refer these patients, they have to wait a long time. So again, if they're in pain or having problems, like Obviously, if someone's infected and like I can take the tooth out, like I'm not saying I'm going to leave a child with like dental infection, but you hate having to get to the point of extracting teeth, especially because sometimes these are permanent teeth just in a pediatric patient if they're 8, 9, 10, 11 years old, right? So then I just feel so bad about it. And it's not like I put them in that situation to be needing this treatment, but it's tough. And I don't really feel like good after, you know what I mean? Whereas other times you feel like you're helping people with this. Like I know I still am helping, but it just does not feel the same. So that's something I'm still working through in the, my own mindset and skill set and everything. And hopefully over time it keeps getting better because these kids and these families deserve that. So I'm doing my best about it. And I'm reaching out to people that are really good with kids to get tips and advice. So the other thing I wanted to touch on when it comes to like procedures and production and things. So I would say, as I've mentioned, like my production and confidence in treatments has just been going up, generally speaking, throughout working, as you would hope. But in January and February, as well as September and October, were definitely the best months that I've worked. November, December, we're down a little bit. And then this month, March, is looking to be down quite a bit as well. Almost one of my worst months of the whole 10 months I've been working. But then you have to consider the fact that I'm taking a whole week off to go to this implant course. So it's kind of like investing in that potential to have an added procedure scope and added production down the line. So like taking a dip now to have more potential later. But as I was saying, even though January and February were such good months, it was kind of impressive because we had some closures for snow days, or patients would cancel because of weather or from them being sick, or we had days where our schedule got messed up, whether it was because we had sick staff members or we had sick patients. So despite all that, those months seemed to be quite high, my highest yet. But then this month is not. So even though I'm having this week off, if I put in like an average production for a week into this month, it would still be a lot lower than those other ones. So I want to reflect, why is that happening and what can I do to improve it? I do know I had a couple days where my anchor appointments fell through due to patients being sick or other reasons. So spending time on reflecting on maybe why that happened and how I can improve the scheduling process to lessen variability in production, whether that be collecting more dollars up front so people feel like they aren't going to no-show or cancel last minute, or if we are doing that, just doing it more consistently. So that's pretty much like our general patient base. I think that would help. The more that we collect up front, the less likely they are to defer their appointment because they've already paid a bunch of money. Or the other situation, as I've mentioned, that state kids Medicaid that we take. So we're not allowed to collect from them up front because they're not supposed to pay us anything. We have to just get reimbursed. That's like the only scenario where we get reimbursed by insurance. Everything else is fee for service and the patients get reimbursed by their dental benefit plan. But with the healthy kids, we cannot do that. So I had, I think 1 or 2 this month where I had given couple hours of time because they needed a lot of treatment, and the patient kind of just wanted to knock it all out because they don't like coming to the dentist and it makes them scared and they would rather just get it done and then not have to come back. So we gave them several hours of time and then they canceled last minute where we weren't able to fill the slot, or maybe we filled it but with low production, like single fillings and things. So because we're not collecting up front, I feel like I need to adjust how I'm scheduling that even if the patient wants to get it all done in one day, phrase it as, we're going to schedule a 1-hour appointment and we'll get as much done as we can and we'll go from there. If we need to set up another one, we will, rather than giving a 2 or 2.5 hour block. That's really going to hurt my schedule if they fall through just because they aren't financially committed. And a lot of times, again, they're kids, they're teenagers. They might have more reasons or things that they're not coming to the appointment for, Other than that, another thing I've been working on is with our newer front desk team member. I felt like this month a lot of stuff got scheduled well in advance from like my hygiene appointments, which was great, but it'd be for 1 or 2 small fillings, right? And then it seemed like they were getting put in my production column in a way that made it hard to get a big anchor appointment in there. So it'd be like staggered single fillings rather than a couple at the beginning of the day, a couple at the end of the day. That way I have most of the morning and most of the afternoon to dedicate to one high value procedure at each of those times. So I just talked to the front desk and the team that does the scheduling about that, about best place to put these low value appointments so that there's more opportunity to actually put a high value appointment every day, which is the goal. So that's some of the things that I had ideas for and kind of takeaways that I had been thinking about. If that's something that you're also struggling with, that's how I'm trying to address it. And then last thing when it comes to production and all of that jazz before we get into the CE course I'm taking in a couple weeks, and we'll just finish with kind of personal life check-ins, how things are going on the personal finance end and overall life. But for production, I'm on the good months. So as in September, October, January, February, which are my higher months, I'm still a solid 15 to 20,000 away of production from my goal. And then a month like this one, March, I'm like 40,000 away. So yeah, March was not a great month. And again, I know in that case, I'm kind of investing in myself this month. And by taking like the income cut, by taking a week off of work, I'm investing in this implant course and the possibility for higher earning potential and a higher desirable treatment that I can have in my tool belt to offer to our patients to help me then reach those production goals. And then another thing that I'll be adding in more and starting more, hopefully, I haven't actually build out and started a clear aligner case, but I have some in the pipeline where they're either going through myofunctional therapy first or they're just doing their disease control first, and then they're going to start their clear aligner therapy. So hopefully putting in more clear aligner therapy, which is already happening at my office. I just had not been the lead doctor on any of the cases. It was going to one of the other doctors primarily because he was the main one that does it, but he's more than happy to have me kind of run any of the new cases. It's just a matter of me planning it and making it sound appealing to patients, right? So I think adding that in as well is going to be helpful to just get that extra 15 to 20 in a month to get me to my goals, right? So implants and clear aligners will be helpful. And I really do think like the only way to get to those numbers on a consistent basis is going to be by having more of those low chair time productions like aligners or scanning for a flex-based partial, like removable pros, easy things that don't need a lot of appointments in order to get to that production goal for the month with how few days that we work in a month, which I'm grateful for. But it's a challenge. I mean, working 13 days a month, but producing enough to be $1 million production for the year. Like that's a lofty goal, right? So it's not easy, but I'm interested to see if it's attainable in 2025 or if it would be a 2026 thing. And either way, it's fine. I know I set a very, very high goal for myself, and it's a high goal also my office set for me. It's not like I'm going to be dinged and like demoted if I don't reach it, but it's just that's our goal. That's what we're working towards, like $1 million production for the year for my general dentistry side of the practice. So next thing is the upcoming CE. As I mentioned, I'm taking the implant pathway, which is like the name of the CE program. If you wanted to look it up, fast track. So I did 37 hours before going for their session 1, and then I will be there for a full week. I get there on a Sunday and I leave on a Saturday, but the classes are Monday to Friday, I think like 7:30 to 5, and the last couple days of the week are in surgery, and the first couple days I think are hands-on with models and practicing as well as some lectures, but I think mostly hands-on since we did 37 hours of lectures already. But while we'll be there that week is sessions 2 and sessions 3. So that's why it's kind of called their fast track bundle, because you get 1 through 3 done in only physically going somewhere for a week. Obviously, you have to do session 1 on your own time before you go, but that's what it is. That's what I'm doing. There's a whole host of things regarding implants, but not limited to implants within this program. So as well as more extraction techniques to do more atraumatic extractions. There's immediate implant placement, same day as extractions. There's grafting, there's PRF grafting, and taking the blood and how all that's going to work. There's sinus lift, sinus grafting. there's ridge augmentation, there's like everything you could think of. And then there's also implants for single implants, for implant bridges, for overdentures, for fixed all on X, all of these things. So obviously in a couple days, I don't anticipate I'm going to be doing every single one of those surgeries I just listed. I believe that they will pair us up with another student in the program by experience and kind of our goals, and then go from there, and we'd get cases that are as applicable as possible to our goals. So obviously, as I've mentioned, my goals are to do single implants. We have another amazing associate. I keep calling him an associate partner now. He's a part owner at our office who does more advanced surgeries. So I don't necessarily have an interest in that, and he does such an amazing job. So really me doing the single implants just frees up his time more to do the other procedures. So that's kind of our thought of how it's going to blend into the office, and also kind of my goals at this point. So far, I've only placed one implant during dental school, which is good, better than no implants. It was part of a overdenture case. So, and that feels like a very long time ago. And it obviously, you know, if you're not doing something on a regular basis, like it feels like I might as well have not done it at all, because I just don't have a much feel for it and all that, you know, compared to doing fillings and crowns all day long. So I'm interested to go to this course. And then at the office, we've been trying to make sure that I'm kind of teed up and ready to go with some potential cases. So we've been kind of keeping our eye out for single implant cases that would be ideally straightforward. I don't want to be looking for the perfect case for 3 months and then never have placed an implant 3 months after my course. I would rather take a case that's okay and just go for it, especially because I'm in the fortunate situation where I have that other doctor here that could help me if need be. So I feel more comfortable jumping into it. But we have a couple cases that we're screening to see if they would be best fit for me, or if they should stay with Dr. Bono, the other doctor at our office doing implants. So I'm interested to see kind of when, from getting back from that course, that I end up doing my first one at our office. Obviously at the course, I'm going to place several implants, but I'm interested to see kind of how it integrates into the office and how quickly we do that. I will probably make a podcast about the course itself, and then about my process of kind of getting that going in our office. So I'm not going to do too much of personal life check-in and like financial check-in at this point, because I feel like 6 months in, 3 months in, I had made it fairly apparent that like I'm pretty settled into working an adult and finances and stuff. Obviously, we're building a house. We have a wedding. We have all this traveling that we need to do for kind of the wedding season of life, like all our friends getting married and things. So there's a lot of expenses, but we are working with a financial planner that makes me feel a lot more well-equipped. His name is John Kahn of Twin Leaf Financial. If you're interested, I can put his website below. He's great. I've had a podcast with him as well that I can link below, but that's who we personally work with. And it's been helpful for the merging our finances process, determining like what type of retirement accounts we're doing, what type of, you know, investment brokerage accounts we're doing, how much we're putting into each thing, determining how much we should versus are spending every month, all of those different things. And I think using the different tools that the financial planner can provide you, like different websites and things to track all of that, has been very worthwhile for us. And it's made the money not as stressful as it maybe could be. So tying that back into like overall health and happiness, everything's really good. As I say all the time, I'm just trying to be extremely grateful and as positive as I can be. I feel like because specifically of the office that I work in, the people around every single day is why I enjoy my work and why I can easier see being positive and being happy, because they're such good role models of that and such good models of gratitude and working hard and trying to be a good person that it just rubs off on you. So I don't have too much more to say beyond that. I'm a little talked out from our long episode, but I hope you all enjoyed this episode, and I hope you maybe got some ideas. If you're also a fresh grad, things you might be working through yourself, maybe this could give you some ideas for that. Or if you're anticipating working in the future, a little look into at least my process of coming up to a year of being out of school, what's been the highs and the lows and kind of transitions over time. With all that said, I hope you all enjoy this week's episode, and I hope you have a great week whenever you're listening to this, and I will talk to you next Monday.